Welcome back, everyone. Hope you had a enjoyable and fascinating lunch and networking break. It's good to have you all back here and online. And we're now moving on to our Champions Hangout. So this is an opportunity for all of us in the room and online to again get on that app and start putting across some questions. I've got some questions already to put to our panelists, and I'll introduce those in a wee moment. But yeah, really excited for them to share their stories of what smarter working means in their organisation, where they're at with their journey, and more importantly, those success stories that they've managed to celebrate, what it's meant to win an award. And that not necessarily has to be the Smarter Working Awards, but obviously under other industry recognised awards as well, and how that's helping them to mature as an organisation. We did have another panellist due to join us, Emeran Saigol, Operations Director of Digital at London Borough of Redbridge. Unfortunately, Emeran's had a family emergency, so can't join us. But I'm delighted to introduce my three panellists. We have Andrew Goodman, Workplace Transformation Director, should I say, at Department for Works and Pensions. Andrew, good afternoon.
Good afternoon, everybody. Lovely to be here.
We have Martin Sadler, Executive Director of Information Technology and Digital at Sandwell and West Birmingham NHS Trust. Hello, Martin.
Hello, everyone. What Andrew said.
And you may recognise our third panellist who was with us earlier today. We've got Stuart Laws, Deputy Head of Strategy and Policy for Defence Innovation Unit within the MOD.
Good afternoon, everybody. Good to see you again.
So, great to have you with us. Perhaps for the benefit of our audience to begin with, if our panellists could talk a little bit about who they are, their role in their organisation, and I suppose your involvement within Smarter Working. Andrew?
Good afternoon, everybody. So I'm Andrew Goodman. I'm the Director of Workplace Transformation for the Department for Work and Pensions, and also Senior Responsible Owner for the Workplace Transformation Programme. For those of you who don't know DWP, we're one of the sort of largest government departments. I think we've just been picked by MOJ now. But in terms of estate, we've got nearly 900 buildings, workforce of over 90,000 people, geographical spread across the whole of Great Britain. So a big organisation. I joined the organisation in April 2020, which was just in the middle of lockdown. And you can imagine in the last 4 years, we went from an organisation that was predominantly office-based to an organisation which has a blend now. So all our work coaches who work in our job centres have been face-to-face all the way through. In our back office, in our service centres, we've now gone into a lot more into a hybrid and our corporate hubs as well. So getting that balance right and managing it has been a real challenge. And I think we're still very much, we are on a journey, and it's still a long way to go, particularly when we've got the estate of the size that we've got, because making it all nice and excellent quality takes a lot of time and a lot of investment. So it's about where do we maximise the opportunities.
Martin?
Hi, so I'm Martin Sadler. I am an Executive Director for Sandwell and West Birmingham NHS Trust. So I lead the digital innovation, the digital scene. So we've been changing how digital works for everybody who works in the trust, in order that we can do more interesting, useful things for patients and for staff. We're about to open Europe's largest emergency department in 18 days' time, Midland Metropolitan University Hospital in Smethwick. We've been working on that for the 6 years that I've been at the NHS, which is why I've got loads of time spare to come and do this.
Cool. And obviously, I introduced myself earlier, so I'm Stuart Laws. I work for the MOD as the Deputy Head for Innovation, Strategy and Policy. So in terms we'd all understand, what that means is everything anybody doesn't want to do, they can tag as innovation, gets thrown at my team. So we look after AUKUS Pillar 2, so that's a relationship between the UK, Australia and the US around technology development and identification, and there's some really exciting projects happening there, particularly around uncrewed systems and how we collaboratively utilise and design and deliver those systems as well. I look after the National Security Strategic Innovation Fund through one of my team, who is the mission partner for defence into that as well. That gives us a venture capitalist approach to new companies and new products and work packages. We look after our innovation training. So what do we need to teach defence people about innovation, why it's important, how it impacts on their day job, why it's something which they need to be involved in rather than accept it happens to them. And then a whole variety of other things. Two of the more better things and less stressful things are Smarter Working Live, where I'm a judge, and convinced Mark to introduce the innovation as a service category this year. But I'm also the defence panel member for the King's Awards for Enterprise as well. And that gives me the opportunity to see what's happening elsewhere and then go and have those conversations on what we could bring to defence, but also what defence could share with others to help them solve problems which they appear to be having.
Fantastic. Okay, so 3 award-winning organisations, a couple of multi-award-winning organisations here. So let's start with that. What innovative approaches did you implement in your Smarter Working initiatives that set you apart from those others shortlisted? And feel free to reflect on those award-winning programmes or wider projects that you've worked on as part of your Smarter Working journeys. Martin, I'll start with you.
Hi, so we won an award for artificial intelligence and innovation. In a hospital, we take over 1 million scans of individuals, various bits of their bodies every year. And on a lot of cases, scans need to be looked at by 2 human beings. So what we did was we got 30,000 scans that had already been looked at and been written about, and we wrote an algorithm to see if we could train a computer to identify lung nodules in lung scans. If you're a radiologist, a professional who looks at these things, you would probably look at 10,000 scans in your lifetime. So 30,000 scans is quite a lot of experience. And we call it artificial intelligence because that's trendy, but actually what it is pattern matching at scale. And we trained an algorithm to pattern match lung nodules and proved that our radiologists are really good at their jobs. There was about 16 out of the 30,000. There were 16 discrepancies in the end where the computer was arguing with the radiologist, at which point you get another radiologist to look at it. We did that because in 5 years or 10 years' time, what we'd really like to do is have a computer and a radiologist look at an image, and then if they disagree, get a third view, which could be another algorithm or could be another human being. To put something like that into a clinical pathway, we have to go through a lot of proof, and it's got to be proof positive. So it isn't in a clinical pathway, but what we envisage is, because we've actually started now, we'll be able to intelligently profile who we should look at first, and have a look at scans overnight and stack that up and prioritise patients. So without making a clinical decision, we still think there's benefit for it. So that's essentially what we did. It was one of the biggest studies, and it was we were really pleased to win. And we're going to talk later about what it means. But that's what we did, and we've done some more things since.
Okay. Andrew, from your perspective, what innovative approaches do DWP adopt in their Smarter Working initiatives, which are helping you to, set you apart from others?
So, as I said, we are a very large organisation in that respect, with a very diverse population, different workloads, different packages, we work differently. There's no common view in terms of what does a DWP employee do, and I think for us that transition and the move to the Smarter Working maturity, which is one of the big achievements for us as one of the largest departments, actually is how do you get people to go on that journey? How do you get everyone to acknowledge that we need to work differently? And I think that has been one of the big challenges for us, understanding that everyone is different, understanding that everyone has different needs, and actually there isn't one size fits all. And getting that right and understanding that has been a real challenge, because actually everybody wants to say, well, what's the answer? Well, in lots of cases, it's up to you. It's a lot, managers and leaders, and there's a lot of leadership in this, which I think we are trying to really empower our leaders to go, actually, this is within your gift, and you need to manage your teams appropriately for the ways you need to deliver. And I think some of our big successes is some of our big service centres, and where we've actually got the leaders to actually think, how do we make this work? How does it work for us? And it will be different. So you can have 2 service centres in different parts of the country and they will work very differently. It depends on the demographic, it depends on the economic and social background of the staff, it depends on lots of different things about what works. And for us, our big lesson and the big thing we are now taking forward is actually, how do you capture that? How do you give people the right toolkit? But how do you not say the answer is X or the answer is Y? Because I can guarantee you that when you say it's X or Y, it won't be for a group of people. So it's about actually, it could be X, it could be Y, it could be something else. And how do you empower people to really think about that and take that forward? And I think that's what we have learned. That's how we started on our journey on maturity. And there's a lot of discussions when we, within our department about, are you really mature? Well, actually, it's about the principles. It's about how you're thinking about that. It's moving in the right way. And for us, actually, that was significant because it did actually say, look, we have achieved something. And I think for the whole concept of the awards, and it's actually proving that you recognise the work that people have put in. And I think that's the key bit for us.
Okay. Stuart, I know that you've got many projects, obviously very passionate about innovation within the MOD, but specifically those smarter working initiatives that have gained that accolade. What set you apart?
Yeah, so I think it comes down to our people, because without our people, we have no expertise, we have no passion, we have no nothing. So the thing that sets us apart, I think, is probably our people. We're never short of ideas. You throw a problem, somebody will find a solution for you. And that is a really good environment to be working in. It makes it really difficult to try and coordinate, but then we have real gems which come out of it. And I think probably the one which speaks the most for smarter working was probably when we were supporting field hospitals in Somalia around the Ebola outbreak. So we had a small team of medical experts in Birmingham who were responsible for ensuring the outbreak didn't become a global issue. And what they did was they worked together with some business analysts and they created a training pack that meant it didn't matter what language you spoke, what level of education you had, you could understand within one session, which is about 30 minutes, what you had to do in that field hospital station. So you would minimize your chance of being infected by Ebola. And every time there was a new infection reported, they were straight on to the environment we had in Birmingham. They ran through what had happened. They analysed that against the procedures they put in place, and they updated everything. And they reissued that training, which everyone then did again. And that whole cycle took 4 hours. So for me, that's probably the best one we've got around the Smarter Working initiative, but also highlighting the impact outside of the environment that it's designed in is the key thing.
Mm. Were there any light bulb moments during these transformation programs which changed the direction or focus of your initiatives, Martin, from what you set out originally?
So I've been in the NHS for 6 years, and I inherited from 7 previous CIOs over the 10 years before that a really awful IT service and a really awful IT department. And we needed to change that. We needed to change the culture and the ambitions. The staff were dissatisfied. And so we picked on some exciting things in order to motivate them and say, if we can fix all the rubbish, we can do the nice stuff. Building the hospital, obviously, we didn't have a choice about, but to actually do things for the hospital was a good reason to get better. And artificial intelligence, we use that as the thing to say, we're here to do exciting things when we fix the rest of it. So actually, the journey to allowing people to innovate and realise they were doing something was sort of crucial. I mean, we weren't going for an award, we just wanted to aspire to something better than we were and wanted to inspire people. But actually most of the work was done by the radiologists, and it was the radiologists who said, we want to do this, or they approach the worst IT department I've ever seen and say, we want to be really good at AI. That was the moment that we seized on and said, okay, let's see what we need to do and how that fits in with getting better. And it dragged us up. Wanting to innovate is why most people go into work, really. They don't want to go in and just do the same old thing. So I think all of the moments and what we learned from it was, as you're doing these things, as you're going through all the getting it wrong and all the things, you're allowing people to fail and allowing people to have new ideas and allowing people to try things that no one else has thought of. And even if they don't succeed, because some of the things we tried didn't succeed, the point is trying. Trying is more important than doing. And we all thanked people. We recognised success, but we recognised failure more because we had more failures. But we celebrated trying. Turning up and trying was really, really important. Mm-hmm. I'm not sure I answered the question, but the question was, what was the moment? And there were like 1,000 moments.
Light bulb moments that caused you to pivot, I suppose.
So yeah, there was a strange light bulb moment when somebody on the help desk said, if we're on the help desk and we fix that, we could take part as well. And it became a whole team then, because traditional IT departments don't always work for who they serve. And actually allowing them to change what they did so they could get involved in the innovative stuff, and allowing anybody, not just application developers or radiologists, but allowing anybody to try something new was the light bulb moment. And he came into my office and said, you're wrong. And I just thought, oh, that's amazing. That's amazing that somebody can actually just approach me and tell me that what I've been doing for my whole career was the wrong thing to do. So that was my light bulb moment, and realising that I'd been doing it wrong for 20 years.
Andrew, from your perspective, is it difficult to pivot when those light bulb moments come up, especially when you're looking at estates, property, workspaces?
Yes, it is difficult, but it's definitely something you need to do, and something about managing the uncertainty and the flexibility that you need going forward. So the one thing, particularly looking at our team, we've got a lot of estates, lots of things to do. Actually, do we know what 2035 will look like, for example? No, we don't. Have we got an idea? Yes, we have. How do you therefore make sure that all your solutions are in a point that actually they can be pivoted and changed as you go through? And I think when you talk about light bulb moments, for me, I think that's one of the biggest things for us. I'm very passionate about diversity and inclusion and making sure that we consider all elements of what we do in the workplace. But actually, the light bulb moment for me is it's more than what we normally think as diversity and inclusion, because it's about also the diversity in teams, in terms of the different types of teams that work, even in a corporate centre where you've got your HR, your digital, your finance, and for us, a large policy department. They all work in different ways, and therefore the solutions to those are very different. But equally, they are on a journey and evolving as well. So what you might have today might be very different in 2 or 3 years' time. So how do you build something, and how do you allow that flexibility? You say, actually, you might want more collaboration space at the moment. Or, as I'm getting in some teams, we don't want collaboration space, we just want desks, because that's how they work at the moment. But actually, as they move forward and they start to use the space, actually, I think we want more of this. How can we be flexible in a large investment programs that these buildings cost a lot of money to refurbish, a lot of time and money to set up and establish, but then in actual fact, in that short time, the requirements might need and the user needs change. So actually, how do you capture that, and how do you make sure you design something which has that flexibility and that adaptability in it? Because I think the one thing that will be certain is what we thought it was going to look like, it won't do in the future. So we are very much now looking at how do we future-proof the solutions, giving a great experience where we can now, but also making sure that great experience is still a great experience in 5 and 10 years' time against, budgetary constraints, which we are all under. There isn't a magic money tree. I haven't found one yet. And unfortunately, therefore, we have to spend wisely and make sure we're getting really good value for money for everything we do. So that's the bit that I've, the big pivot for me about how do you maintain flexibility.
Okay. Stuart, from your perspective, we've talked a lot about building a culture of innovation and collaboration across different teams within your organisation, different departments and different stakeholders. Martin mentioned then about ideas. How important is it to, I suppose, build and foster a culture of ideas management within an organisation in order to implement some of those initiatives?
So the flippant answer is it's critical. The slightly more reasoned answer is everybody has an idea, not everybody has a good idea. And you've got to be able to give people the ability to raise their head above the parapet. So coming back to the conversation with Ian, that you've got to have that psychological safety. People have to feel comfortable to be able to challenge. And you've got to give them an avenue to do it as well. So our ideas management strategy takes away the management chain from those ideas. So we will go a challenge-driven approach using the Wazuku tool. So a problem owner will present their challenge. We will guide them through a problem curation approach so that the problem's understood. It's something which we need to resolve and isn't immediately resolved one another way. And then we'll crowdsource. And people know that if they spend time crafting a response to those challenges, somebody's going to read it, someone's going to pay attention, and we will always tell those teams a fast no is far more empowering and engaging than a slow yes. So you've got to have a process in place which provides a psychological safety, but also which is visible and transparent so everyone can see what is happening to their engagement because they've invested some of themselves to help you with that problem. And that's the key thing for me.
Okay. So a question, I've got my iPad working now, so I've got the questions coming in. Sorry about that. One question that's come in on that point. You have 2 projects. Leadership will sponsor 1. What are your considerations to choose and how you show people their ideas are still valued? So, Martin.
Why would leadership only sponsor 1? Change leadership. Yeah, you've got 2 ideas. What if they, you review them both, don't you? You review them both, and you obviously look at, is it easy? What's the impact? What's the change? Does this fit with what we're measuring? But you have hundreds of ideas. I think if the leaders actually said we can only do 1, you just got to really question what the leaders are doing and how they behave. And we have, the way we look at it is we have a vision. We have a destination and we have a set of core measures. And one of our core measures is how much time have we saved? Or the reverse is, how much of your time do we waste as an IT service, as a medical engineering service, and how can we reduce that? So if we did have to choose, we would look at the one that collectively saves the organisation the most time, because time saved, we haven't got a magic money tree, time saved equates to a better standard of care for the patients who are going through the NHS. So we would just look at how much time does this save.
Andrew, 2 projects, leadership can only choose 1?
Well, I am with Martin on that. I think, actually, I think we just got to be careful that you might get to a point where you've done the evaluation, you've looked at it and you decide one, and there might be some in terms of constraints. I mean, some of the challenges we have is a natural fact, our ability to deliver change in a large organisation with lots of change coming in. You do have to sequence it and make sure you're doing the right things. I think it's about the value and quick wins, and sometimes it's perhaps you can't do all of one or all of both of them, but are there actually some really good elements you can do and you can progress them together? The capacity to absorb change is something I don't think we should underestimate in an organisation. And I think that's one of our big challenges, that everybody's got good ideas, everybody's got really good things they want to do. Actually being able to adopt them and use them in an organisation is a challenge. So actually, I think the leadership responsibility there is actually working out which is has the maximum impact, which might mean that it has a big impact on actually delivering what it's doing, and actually is that worth it? So it's that balance, I think, and there's a discussion about productivity coming up next, but actually this whole question about actually does that change actually improve productivity or does it impact productivity? It might have a long-term impact on productivity. Ultimately, it's better, but actually, how do you time that? How do you position it? And I think that's the bit that the leadership needs to be looking at. It's the impact of that change, and therefore, how do you make sure it works for the business?
Okay. Stuart, I'm going to come to you. And the good thing about this, the questions online, is you can like the other questions, and then they go up in my pecking order. So you can have a look at what other people are posting. But just one that I want to come to you that Emma's asked: what key attributes do leaders in your organisation possess that has helped to shift to an innovative, or a culture of innovation?
So first off, I'd say defence is still moving to that culture. We're not there. And that's probably the first thing those of us in senior leadership positions need to do, is recognise it's still a journey. I think there's a lot of empathy there. I think there is a degree of communication. But I think for me, one of my personal, sort of coming back to previous questions around light bulb moments, and a bit of a growth moment, was realising actually as a senior leader, I don't need to do things. My role is to lead the team and make sure my team has the expertise and the knowledge, and they are supported to deliver that work. And for me, those are probably the most important things in order to do that and to create that culture, because you've got to do it the right way, or it's just going to come back and bite you. And if you get it wrong, everyone will remember you for getting it wrong, and no one will want to come and work for you. But if you get it right, everyone will come and work for you, because they know if they work for you, they're going to go on to bigger and better things because of your input and your leadership.
Okay. Martin, there's a question specifically for you here. I'd be interested to know if the scans are, let me just check this, sorry, are sex disaggregated and even contain data on race, so the technology doesn't disproportionately affect patients by design.
That's a really good question about AI, because AI learns from experience because it is learning. So actually, if you've had discriminatory results in the past, you will train an algorithm to discriminate as it has learned from the 30,000. What we did was we pseudo-anonymized it, and we're talking about a scan of a lung. And once you get under everybody's skin, apart from the number of ribs, most people's lungs and the bits that we were scanning are the same, apart from some of the nodules are white and big, and some of the nodules are not white. It's a really difficult thing when you take into... So Sandwell and West Birmingham is diverse. Over 100 languages, first languages spoken, a really... it's the melting pot. People come from all over the world, and people are different, physiologically different. So we have encountered scans where some people have more fatty tissue than other people, depending on their genetic makeup. So that then makes it more difficult for the radiologist, but 30,000 scans didn't pick up any biases about race, gender, because that hasn't come out, unless it has come out and we didn't even know about it, but you don't know about the person. Well, as a radiologist and therefore as the algorithm, we only saw the inside of the person.
Okay.
There's almost a love message there, isn't there? That if we only could all be radiologists, then maybe the world would be a better place.
So a follow-up question again, just to you on this. When you're using technology such as AI, do you think it's right for patients, customers or claimants to be able to opt out of their data being used in those processes?
Yeah, this is... how long have we got?
Maybe just at this point it's a good idea to plug your book, perhaps? Or
No, we'll do that later. We almost got a plug-in for it. Right. Should you opt out of your data being used? I think your data and our collective data has the benefit to look at trends, from a health point of view, has the benefit to look at trends and to see if we can prevent and to see if there are common things and what in hospital they call comorbidities, which actually is, oh look, you've got that, which means likely you'll have this as well. I think, yes, people should be allowed to opt out. And I think in opting out, they should opt out of healthcare as well, because this is collective good. But just because, we're going to go into a conspiracy theory now. So I get asked a lot about whether we invented COVID as the NHS or as the government. And I've worked in local government and I've worked in the NHS and I've worked in the private sector. And if we can't even write you a letter about your appointment before your appointment, how on earth could we coordinate a massive conspiracy on COVID, is my view. And I think people should be clear about what they're opting out of. We should not be sharing details, personal details, but in terms of a healthcare and in terms of health trends, a bit like you said about Ebola, yeah, why would you be putting that back to an individual to do that? And if we go back to the lung scans, we anonymised it, so we didn't know. But actually, if we found somebody who had potential cancer that we'd missed, and we did, and we thought it would be in the best interest of that person that we found out and let them know, we could still track it back and say, let's bring this person in for another scan. So could you opt out? If you really want to.
should you?
But if you don't want, should you? Probably not, because it's not really kind of...
So we've had a number of other questions for Martin, which I'm not going to throw him because I've got quite a lot to get through. But you can ping him online. That's the whole point of this platform. He's there. He's a delegate, he's a speaker. You can message him directly. If you're in the room, you can grab him afterwards. But I do want to move on. So I want to talk about the strategies that you use to engage employees and end users to get them on board with the changes introduced by your Smarter Working projects. How did you communicate those? How did you get buy-in, commitment, that you're all on the same journey, one journey, the benefits of that? What did you do, Andrew?
I think the challenge of communicating the message is a big one. It's a big one for us, particularly with, as we roll this out, it's not going to hit everywhere at the same time. So if you do department-wide communications to your 90,000 workforce about all the good things you're doing, there are a number of people in the organisation that goes, yes, but my bits don't work, or this isn't my experience. So getting that balance right is really important. So actually you have to be really mindful about actually, you know, the whole, you have to be empathetic for your colleagues and understand actually, you know, the message you're saying, you need to promote what you're doing, you need to give them the journey that you're on, but equally you need to acknowledge that in some areas that will be some time before it arrives. What we have done is very much using the leadership and a lot of smarter working is down to leadership for me. It's about actually having leaders which believe in it and leaders which empower people to do it. And we've done a lot of focus groups with different leadership groups, and that comes back to my diversity. So we haven't put all of it's not necessarily even the same building. It's actually particular colleagues in a building of a particular working on a particular area, getting them together, engaging with them, and making them feel empowered to help us on that journey. As we move forward and we're looking at how do we start to refit some of our buildings, how do we start to operate in a different way, again, we engage early. Engage with the team, to have focus groups, get colleagues in and say, okay, what is working, what's not working. That does help. And the other thing we are now doing also is doing a lot more use of videos and technology. So in actual fact, we've put pods in, we've put some different breakout areas. Actually, we were finding people going, oh, that's all very nice, but what do I do with that? And actual fact, we've tried to do some bite-sized videos, some other bits, which just go, actually, this is how you can use them. This is what you do with them. And that's how you start to break down that. And actually, that has been really helpful. What we've also done is had feedback from what we have done. And some people say, well, those bits don't work. They don't work at all, actually, or if you're going to do them, you need to put them somewhere else because it doesn't work in the dynamics. And again, we're feeding that back in and going, actually, okay, for in the future, we'll do something different. But that's, again, the challenge of actually, do you change the site you've already been to when it might not be due for another lookout for another 4 or 5 years? So it's getting that balance right. So I think it's communication is at the right level, but making sure actually our leaders understand this, and the leaders can actually say, actually, yeah, we're not quite there, but this is part of the journey, or we have got this, how are we using it, and making sure that they feel fully empowered to embrace smarter working, which is what we've got to do. It's not something you can do top down.
Okay. Stuart, from your perspective, how do you help maintain momentum and enthusiasm?
So a lot of it's through personal lived experience. So when we're talking about a particular project, we will have a storyteller. So there is a big difference between news communications and storytelling. Storytelling is really powerful. If you want a way to engage somebody and make them think your idea is their idea, go on a storytelling course. So that's my plug of the day. But what that allows you to do is to take the person you're engaging with into your experience and to share that experience and where the benefits were and why it mattered to you and why therefore it's going to matter to them as well. So I think building on all the answers we've got here, that's really the key thing. If you've got people who are unsure or cautious about engaging with something new, then being able to talk to somebody who's already experienced it is a really powerful approach to it.
Okay. We've had a question here, and it kind of ties into what question I was going to ask. So the question that's come in is, when innovation leads to savings, have you struggled in those savings being realised, or have you accepted them just as time savings? And my original question was going to be, how do you measure the success of initiatives? What tangible outcomes and benefits did your organisation experience, and how, I suppose, then you tie that into that communication, which is crucial across your organisation? Martin, you talked about the number of, number of beds or number of, well, in this instance it was scans. Yeah. But you maybe can reflect on that question.
I think it's really tricky to encourage people, difficult to encourage people to innovate. And I think one of the greatest ways you can stop people innovating is ask them for a business case with savings. And you must get this all the time. How much savings are you going to make by moving someone out of a building? And then you start saying, well, actually, maybe we've started this on the wrong foot. If you are going to have savings, you've got to measure something properly, and what you'll find is your innovations, your savings actually are someone else's budget savings. And so there's all this innovation preventative practices by doing business cases. But sometimes you will do something that will create a saving in time. I have never seen an IT project actually save people, although this will get rid of 20 people's jobs, and what actually it does is it spreads 20 people's jobs over 100 people who actually can't do the job as well as the 20 people who were doing the job. And then we all end up becoming proper accountants because we can use an online system to do our accounts even though we don't know what we're doing. So I'd say if you're doing innovation for savings, then you're probably starting at the wrong place. But if you focus on what your organisation is about, you should do an innovation based on promoting and improving what your organisation is about, maybe doing a bit more of it, which on a traditional spreadsheet might not quite be the saving that you're looking for. So, could I prove that I've done savings? Not yet. In 15 years' time, when it takes one radiologist, not two radiologists, to look at 500,000 breast screenings a year, it'll be too late by then, won't it?
Okay, Martin. Oh, sorry, Andrew.
Yeah, so I think that it's a really interesting question. So part of the program that I'm delivering is about, we're looking about delivering a smaller, better, greener estate along with GPA. So in actual fact, if you break that down, actually smaller is quite straightforward. I have less estate than I had when I started. Greener actually is quite straightforward as well. And Martin and I were talking about EPC ratings of buildings and how you use those. There's some really good targets there. It's about carbon outputs. That's okay. You can do that. So I can do I can do smaller. Yes, we are smaller. Smaller then drives savings from the cost of running it. Better. Good one. How do you quantify better? And that is really difficult. And I think that's one of the challenges we've got. Actual fact, yes, it feels nice, it looks good, but actually, when you're talking to Treasury colleagues about, can you fund us, please, for better? Well, what does it give us at the end of it? And it is really difficult to do, and I think that's one of the big challenges. So we are looking at some more qualitative analysis about actually, what do people feel? How does that take them through? We use things like our staff survey results to go actually, have we seen a shift in people's perceptions and their well-being, because it all contributes to that, the workplace. We are also trying to build make it a great place to work. Well, actually, if you make it a great place to work, can you start to look at your utilisation of your building? Can you say, in actual fact, with the improvements, actually, yes, our buildings are being used 60, 70, 80% of the time, which is actually, again, good value. Actually, if they're only being used 50%, 40% of the time, we have problems. It's a waste of public money. So I think that there's lots of different angles on this, and some of them are straightforward. So we have delivered lots of savings because we no longer have buildings that we used to have. Trying to put some of the other values on are really challenging, and I think that's one of the big things we probably need to think about, is how do you quantify better? How do you quantify what a great place to work is? Because actually, that does take investment, and that investment needs to come, but it needs to be against a business case, as you say. It's really challenging. So I think I'm not necessarily answering totally the question, but I'm going to pose the question: how do you quantify better?
Okay. Pop that in the comments section if anyone's got the answer.
If you've got the answers, please.
Stuart, how did you measure the success of initiatives that are driven from the Defence Innovation Unit?
So it depends on the initiative. So we've got our Ideas Management Initiative, which has been running for decades. We can only really put our finger on the data properly going back to probably 1990. There used to be a big focus on the money saved, but quite frankly, if I ask you to give me an idea that's going to save me money, that's not what you come to work for. So you're not going to give me an idea to save me money. If you do give me an idea that you think saves money, you probably think you're saving me £1 million, and in fact you're maybe saving 100,000. So suddenly we got an expectation disagreement straight off. So if you're using that to drive your approach, you're on a hide into nothing straight away. But it can be done if you view it as a consequence and a side benefit of delivering an ideas or an innovation program. So innovation as a service is going to cost you as a business. It's going to cost you time, it's going to cost you money, it's going to have people who are specialists who from the outside are going to look a little bit odd. They're going to ask the questions you don't want asked, and they're going to make you feel uncomfortable if you're a senior leader. That's success. If you're making somebody question what their decisions were and what their questions were and whether they were the right questions, that is an innovation success. That will lead to savings and change, because the only way you're going to lead to change and generate the savings is by challenging the status quo. That is a key thing for it. So yes, we track savings. I think maybe 1.5% to 2% of our ideas have actual savings associated with them. Some of those are quite large, and they become tangible really quickly when you get to the business case, but not before the business case stage. Most of them have efficiency savings. So you might save 5 minutes a day for everybody in the team. You'll say, well, that's equivalent to, I'm still paying the wages, so they're not an actual saving. So understanding the difference between quantifiable, cashable saving and efficiency savings then becomes key. But I did a podcast with Simon Hill from Wazuku a little while ago. So we spent about half an hour to an hour talking around metrics around innovation. So I'd recommend people go and have a look at that, where me and Simon basically slate everybody for having the wrong stats driving their innovation approach.
Okay.
Can I ask a question? You've mentioned Wazuku twice.
Yep.
I'm sure I'm the only person in the room, actually. Everyone else knows what Wazuku is. Could you just give me a...
Yeah, so Wazuku are a London-based SME. They provide a crowdsourcing platform and some additional services which will help you better understand your innovation needs and how you can approach it. They provide the platform which everyone's used for Smarter Working Live, so all the nominations went on their platform. They are supporting the Cabinet Office for One Big Thing this year. So all of your case studies for One Big Thing this year will go on the Wazuku platform. And if you've got your own ideas platform, it'll just be a portal to your own ideas platform. That's another innovation win. Challenging the Cabinet Office to not do something, that's a good conversation to be in. So they're a really good company, and they've got 500,000 problem solvers worldwide they can tap into. They'll help you with your problem statement. So they're a really good partner to have.
We're not sponsored, are we? We're not sponsored by
We are not sponsored. Well, actually, they're sort of sponsoring, because they provide the platform and they're in the corner in the foyer as well. So go and talk to Ricky, Dino and Sophie. They're a really good team. They'll answer your questions without you being a customer as well, and they'll just give you the rundown on everything as well.
So I want to talk about how has your organisation continued to evolve its smarter working approach since, I suppose, winning the awards, and what are your next steps? And I want to tie that into a question we've had, which are, what are your most challenging ways of working issues right now that you're facing since winning your awards? Martin.
Feel like you're being picked on.
Where'd you go after such an accolade?
So the most challenging thing for the NHS is the NHS wasn't built to the capacity of people living as long as they are living and as unhealthily as they are living. So our biggest challenge is we have to deal with people from a health point of view who aren't very healthy and are old and aren't very healthy. And so what we try and do is find better ways to deal with the people who are in that situation, and quicker ways so that we can free up time to focus on the people who are digitally excluded, who are unable to engage with us in any other way, and who need our help. So that is the biggest challenge. The biggest challenge is we have a finite amount of resources and a growing unhealthy population. How do we get over that? We look at there isn't one big answer. So every time we look, we say, does this help? Could we save 3 minutes off the waiting time? How do we stop people missing appointments? So we actually, the AI thing that we did encouraged us to do some other AI things. So one of the things that we did was we trained our computer to turn an MRI scan into a 3D print, so we could print out your bone structure so that we could have a look at it before we operated on it, which saves time in the operation, because we've actually had a look at a proper bone structure specifically to you before we go in. It's not going to hurt you, it's only going to improve it, but also it helps explain to the patient what's going on, it helps explain to junior doctors, trainees, what's going on. So we've done that. We've also looked, we've put through an algorithm of why don't people turn up to their appointments, and found out what it's to do with. Is it to do with where you live? Is it to do with who you are? Is it to do with the type of person? And actually, what's really upsetting is it's obvious. You didn't turn up because we chose the time of the appointment. They didn't choose the time of the appointment. And we've known that psychologists have known that for 30 years, that if somebody chooses when and where they're going to, they are more likely to present than if it is chosen for them. So it's helped. But sometimes you put loads and loads of work in and everyone just says, well, that was obvious, wasn't it? What a waste of time.
Andrew?
So I think smarter working is business change, and therefore business change is all about people, and actually understanding that actual fact there is a long journey to go with the people is probably the real challenge. So with my team, I'm just recruiting a new team to look at sort of the business change, and I hesitate the cultural change because if we could solve the culture, it's all very easy. It's not. But actually going on that, getting people to think differently, getting people to adopt it. And I think one of the barriers to this is actually in all our organisations, people are very busy. They're very busy doing the day job, very busy delivering. And actually you're asking them to do something different. Actually, that's a challenge. You've got to try and make sure that they understand that and actually really embrace that, and that takes time, and they've got to see the benefit from it. And you've got to invest in that, and invest in some people that have the time to make sure the messages land well, and there is an understanding of what people are doing because they can see the value at it in the end. I think there's no doubt that the smarter working will make and is making our organisations great places to work. But actually to take everyone on that journey takes a long time, and we as leaders have actually got to invest in that time and make sure that we do the right things and the right tools are there. And I think that's one of the big challenges for me going forward is how do we get the adoption, how do we get people there, and how does it become self-fulfilling rather than always being driven from an organisation? Because a programme that I'm on is a temporary structure. It will go. So in actual fact, but one thing smarter working will be, it will always be evolving, it will always change, because the nature of work will change, and it won't be 2030 we're all done. I don't think so. 2030 will be the start of the next change, because that's that's the way we're in at the moment.
Okay, so we had a question here actually, which was, what if your main teams are too busy to engage with your change programme? And yesterday in the Judges Hangout, interesting comment from the LGA was, how do you make change land? Stuart?
Give me a moment. So, I think it sort of goes back to the previous question as well, and that's for change to land, it's got to mean something to people, and people have to engage with it. If they don't engage with it and they don't believe in it, then it will survive your involvement, and it becomes very personality based. So therefore the biggest challenge we've got is, how do we take our innovation approach and deliver something which can be replicated, whether that's a project being replicated somewhere else, or whether it's providing a mechanism that allows the conceptual challenge the organisation, challenge how things are done, bring new things in as being a replicable process or model. That's the key thing. But that means you have to accept your innovation team, they've got one goal, and that goal is to get the business to a situation where the innovation team is no longer required.
Okay. I'm going to change the question slightly for yourself, Martin, in a sense of we've had one that's about how you address the public reaction to using AI technology to support the diagnostic process, getting over the computer says issue. Computer says no. But I suppose that goes back to change as well in how you deal with that. So on that question, how have you been addressing, well, not necessarily just the public's reaction to using AI, but were there any radiologists in the department as well that were against it?
So it was radiology led, and the head of radiology said to me, the computers are only going to replace radiologists who don't think they'll be replaced by computers. And I think it was well received. This is about using a tool to support a process and to support an outcome and to support a diagnosis. And I think we've got to remember that there is resistance to innovation. And one of the examples I use is, driverless cars have killed people. The first ever train journey from Liverpool to Manchester, they stopped halfway, they got out to have a look at the train, and somebody was killed by the train going in the other direction. So if we said, let's not have trains, then we wouldn't innovate anything. So we've got to accept that people are going to be worried about this, and actually we haven't yet introduced AI, so AI is making a decision on your healthcare and on your life, and I don't think we ever will.
Okay, we've got a couple of minutes. So from each of you, what advice would you give to other organisations looking to achieve the types of success that you've achieved within their own smarter working journeys?
I'm not going first this time.
You're not?
No. I think you are.
He keeps looking at me, so I guess I'm going first.
Safe place.
Safe place. So the key thing really is you've got a whole bunch of problems. You may or may not know what those problems are. You need to find a way that makes sense to your business what your approach to problem curation is, so you can understand whether it's a symptom or a cause of the problem, so you can then tackle the core problem. And the people who are best placed to tackle that problem are probably your people, because they're closest to it. And unbeknownst to you, they've probably got some workarounds, and you need to spend some time with them to turn those workarounds into the way the business operates in those areas.
Andrew?
So I think one of the big areas for me is about how do you make sure that you incentivize appropriately to get the innovation and to get the different thinking and to get the change delivered. Going back to the big operational areas, actually the big focus is getting the day job done. Actually, you've got to also give a bit that actual fact, yes, you've got to do the day job, but we've also got to do the transformation. We've also got to do moving to a new world, and actually that is part of your job. And the challenge you presented earlier, Mark, about teams don't have time for this, actually it's about how do you make that bit of time. It's not all the time, it's a proportion of the time, but a bit of time, because actually those teams do have the answers to the questions. And in actual fact, embracing that, but making it, actually we do want you to transform, we do want you to think differently, we do want you to use the technology we're giving you, rather than going, actually, okay, it's okay if you haven't got time to do it. That's the big problem. That's the blocker to it. Actually, it's making that, and actually that comes from potentially from leaders, from management structures, all the way through, actually going, what have you done to make this a better organisation for the next 5 years? Rather than actually you've done a brilliant job today, but actually, does that make us fit for tomorrow? That's, I think, the bit for me. How do we get that right? And if you can get that right, I think that's how you can make sure that smarter working is delivered.
Okay. Martin, your opportunity to offer some advice and inspire.
So Stuart said make it everybody's job, which is absolutely right. Andrew said keep going, which is absolutely right. I'm going to go for something slightly off the wall. A lot of people in organisations have had ideas in the past and haven't known why they haven't been taken forward and thought that was a great idea, and some people have given up and said, well, I had that idea ages ago and do that. So I would go for this approach. The first thing you do is you recognise that for some people, getting to work is the hardest bit of their day. So you thank people for getting to work. You thank people for coming to work and being at work. So everybody starts to feel appreciated. Then you thank them for trying. So trying a bit more. And so you have got fewer people than you just thanked for coming to work. And then you thank them for having an idea. And you thank them regardless of the quality of the idea, but you thank them for the activity and that thought process. And then lastly, you thank them for having a good idea that helped. If you imagined it was a running race and you only thanked the person who came first every time, the other 10 people in the race will give up running. And actually what you need to do is make sure that nobody in your teams, in your organisation, gives up running. So you start by thanking them for being at work.
Ladies and gentlemen, Stuart Laws, Martin Sadler, Andrew Goodman, thank you very much for joining us.
Pleasure.